Hello, this is Neil Baum again from New Orleans, Louisiana. And this is a continuation of the previous video on enhancing communications with those who refer patients to your practice. I mentioned in the last video about the 4 pillars of a successful practice. And today I would like to emphasize one of those pillars, your relationship with those who refer patients to you, referring physicians, and also non-physicians who have the potential to refer patients to your practice. I suggest you take the time and energy to personally meet every physician who refers a patient to you. For example, it is not uncommon in July and August of every year to receive announcements of new doctors in the community. I suggest you reach out to these new doctors, introduce yourself, tell them who you are, what you do, and what are your areas of interest and expertise. Also, keep your referring physicians abreast of any new changes and developments within your specialty. I recommend a quarterly or every 6 months newsletter to your referring doctors. You want to make it easy for referring doctors to have access to you. I suggest you give your referring physicians your cell phone number and also provide them with a number to the back line of your office so they can get immediate access to you and to your practice. I think it's important to recognize the achievements of your referring physicians. This is an annual publication regarding the best doctors within the community. One of my referring physicians was on this list and showcased in this article, in this publication. And I reached out to her and sent her a congratulatory note on being accepted as one of the best physicians in New Orleans. I ran into this lady several weeks later, and she mentioned to me that I was the only physician that acknowledged her achievement. In addition to recognizing the achievements of your referring physicians, I recommend that you acknowledge the accomplishments and achievements of their family. For example, if one of your referring physician's child got into college and received an acceptance letter and that information was shared with you, send a note of congratulations to the referring physician as well as to the child. You will often be stopped or asked questions, clinical questions in the hallway or in the doctor's lounge about a clinical situation. You want to become, for as much as possible, considered a value-added resource. So if somebody asks me a question about hypogonadism in the hallway, I would go back to the office at some later date and answer their questions and send them any articles that are pertinent to their questions. I think it's important to manage interruptions when referring physicians call. I'll never forget a patient who I was seeing for the first time, and I was called out of the office 3 times while that patient was in the exam room. Finally, on the 3rd time that I came back, the patient said to me, you know, you're a very good doctor. You have a very nice reputation, Dr. Baum, but I don't believe I have your undivided attention. And they indicated that they were going to seek another physician. I was very deeply uh, found that to be a very difficult, uncomfortable situation. I never wanted to have it repeated again. And so I set up a situation where I was only to be interrupted when I was with the patient if I got a call from the emergency department, call from the operating room, or the intensive care unit. When another physician calls your office and they ask to speak to you, educate your staff to state that you are doing a procedure and ask if it is an emergency, and if you have permission to call back when you are between patients. I can assure you that almost every physician calling to communicate with you will accept this alternative or this option. One caveat: when you place a call to return a call to a referring physician, be ready to take that call. Don't have them wait on the line until your receptionist tracks you down and then gets you on the line. You will find this is a pet peeve of most doctors who are trying to reach out for a physician and are waiting to get in contact with that doctor. I think it's important to share medical information with your colleagues. Healthcare information is increasing at an exponential rate, and it's very difficult for all doctors to keep abreast of their specialty and new developments within their areas of interest and expertise. And I recommend developing a no meeting journal club where you send educational material to your colleagues. However, if you send an article to a colleague, you're suggesting that they read the entire article, which is unlikely that they will do. However, I believe if you target their reading and place a post-it note on the article that you are faxing or emailing or sending to the referring physician, and tell them where the pertinent information is, and then you circle that information, now you become a value-added resource. If they want to read the article, they can, but they get that information in a very abbreviated form, and you will be considered a value-added resource. Hopefully, they will do the same for you. I recommend that you notify referring physicians at times when you admit his or her patient to the hospital. Send a note, just a brief note or a message to the office after you operate on a patient, or if there's a significant lab report. And finally, if you are discharging one of the patients you are sharing together from the hospital, let that referring physician know. Finally, I want to talk to you about attracting non-medical referrals. There are numerous opportunities for other non-physician referrals who are in your community, who are likely to be able to refer you patients. For example, a pharmaceutical representative is often asked by their friends or family what doctor to use. They have access to dozens of doctors in the community, and they can be a value-added referral source. One of the best ways to attract the attention of a pharmaceutical representative, of course, is to use their product, but second is not to make them wait and see them in a timely fashion. Here are other lists of non-medical referrals. I put at the bottom, the barbers, hairdressers, and manicurists. It is amazing how many potential patients will share intimate details with their barber or hairdresser, and they have the capacity to refer patients to your practice. Finally, I'm going to talk about gift giving. Gift giving is less than 1% of why physicians refer to a practice. I suggest you avoid the usual wine and cheese basket the week or day before Christmas. The reason is that that referring physician is likely to get 10 to 12 of those wine and cheese baskets, and yours won't be differentiated no matter how delicious the wine or the cheese looks. It won't be differentiated from the others that they will be receiving at that time. I suggest you find a gift that is an ongoing gift, like a magazine subscription, or giving the gift in a timely fashion and make the gift unique and special. One of the best gifts I ever gave was personalized luggage cards. These cards were laminated and in bright colors, and they put on their suitcases, and they were able to identify their suitcases at the baggage retrieval. By the way, I did not send out luggage tags with my name on it to that referring physician or non-referring physician. Well, I hope you found this brief video on attracting physicians and non-physicians to your practice helpful and useful. If you have any comments or suggestions that you would like to share with me or fellow viewers of our video, please let me hear from you. Thank you.